Hello everyone, we are the group 3 and we are going to report about the Universal Health Care Law in the Philippines and its significance to the medical tourism. By the way, I'm Lalaine and I will be the first reporter from this group. So, our topics will be about the Philippine Universal Healthcare Law, and we just chose 5 Philippine healthcare law that we think it might help the medical tourism. So first, let's define what is universal healthcare. So President Duterte signed RA 11223 or the Universal Healthcare Act into law last February 2019. So this act will ensure that every Filipino is healthy, protected from health hazards and risks, and has access to affordable, quality, and readily available health service that is suitable to their needs. So, did you know that all Filipinos will benefit from the UHC Act? The government will ensure that the well-being and health needs of all Filipinos, especially those of the vulnerable population, will be addressed. Next, are all health services are free through UHC? So one of the goals of the UHC is to decrease the out-of-pocket expenses of family. So this means that some health services may become affordable, but not everything will be free. So the prices of health services or health goods will be predictable and affordable. So we know the UHC operates. So according to the implementing rules and regulations, they expected that the UHC will be approved by September 2019. There are 33 advanced implementation sites preparing for the rollout of UHC in 2020, and there are 2 more batches to be followed. According to the Department of Health, the treatment, promotive, medicinal, rehabilitation services, and preventive health services should be accessible to all the Filipinos.
Hi! Hi everyone, I'm Jeremy Bale and I'm going to report the leadership and governance. So, when we talk about leadership, it is about influencing people by what you say and do. Good leadership is influencing someone to do something well or better. Great leadership is when you influence someone to be the very best thing they can be. So, while governance is the term for the way a group of people, such as a country, do things. So it means that processes and institutions produce results that meet the needs of society while making the best use of resources at their disposal and covers the sustainable use of natural resources and the protection of the environment. So, why is it that leadership and governance is important? So, leadership and governance is important to help our country grow. So, they have a clear mission and vision for the future and align their decisions with them. So, leaders and governance follow a specific strategy and help to create a corporate culture that's conducive to success. The Philippine health system is highly devolved, with significant responsibilities held by the country's 1,488 municipalities. So, in 1991, the Philippines government introduced a major devolution of national government services, which included the first wave of health sector reform through the introductions of the Local Government Code of 1991. So, um, the code devolved basic services for agriculture, extension, forest management, health services, barangay roads, and social welfare to local government units. In 1992, the Philippines government devolved the management and delivery of health services from the National Department of Health to locally elected provincial, city, and municipal governments. So the aim of this is to provide a background to the introduction of devolution to the health system in the Philippines and to describe the impact of devolution on the structure and functioning of the health system in defined locations. So devolution is the transfer of powers and funding from natural to local government, and it is important because it ensures that decisions are made closer to the local people, communities, and businesses they affect. So the result will be more effective and better targeted public services, greater growth, and stronger partnership between public and private and community leaders in local areas. Next is the UHC law aims to clarify and delineate the overlapping functions of government agencies. So UHC means that all individuals and communities receive the health services they need without suffering financial hardship. So it includes the full spectrum of essential quality health services from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. So UHC also referred to as a kalusugan pangkalahatan, and it is a government mandate aiming to ensure that every Filipino shall receive affordable and quality health benefits. So, a people-oriented approach for the delivery of health services that is centered on people's needs and well-being and cognizant of the differences in culture, values, and beliefs. Next is at the local level, the public system will be reorganized as province or city-wide health systems within which healthcare provider networks or HCPNS will be formed. So the implementation of the Local Government Code of 1991 resulted in the devolution of health services to local government units or LGUs, which included, among others, the provision, management, and maintenance of health services at different levels. So broadly speaking, that the health-related activities of state and local government are traditional public health, including health monitoring, sanitation, and disease control. So LGU have the ability to promote health in their community, and through healthy community designs, parks, on recreation facilities, and healthy living programs. So what is Health Technology Assessment or HTA? So HTA refers to the systematic evaluation of health interventions developed to solve a health problem and improve quality of lives and health outcomes. So it uses a multidisciplinary process to evaluate the social, economic, organizational, and ethical issues of a health intervention or health technology section or section 4N. So health technology assessment is the systematic evaluation of the properties and effects of the health technology, addressing the direct and intended effects of this technology as well as its indirect and unintended consequences, and aim mainly at informing decision-making regarding health technologies. So the purpose of HTA is to provide policymakers with evidence to inform decision-making and develop guidance on the reimbursement and administration of new health technologies in a natural healthcare, in national healthcare system. As such, HTA is regarded as a bridge between research evidence and health policy. Next is, what is the scope of HTA? So HTA will cover drugs, vaccines, medical devices, medical equipment, medical and surgical procedures, preventive and promote health services, traditional medicine, and other health-related interventions that are seeking coverage or funding in the public sectors. Sect 4N. So health technology assessment is the multidisciplinary field of policy analysis that studies medical, social, ethical, and economic implications of the development, diffusion, and use of health technologies. So it's worldwide diffusion that needs to be understood in the context of evidence-based healthcare delivery policy, and it is strongly driven by the search for new cost containment policies by the governments of the universal healthcare systems. Next is, why does health system need HTA? So with the growing demand for healthcare and the limited resources, priority setting is crucial in the health system, and HTA will serve as the primary tool in ensuring that health services and goods provided by the government are cost effective. So health technology assessment has placed at the disposal of the healthcare community various potent tools to improve patient care. So virtual reality devices and apps help ease symptoms of depression and anxiety in older people and patients with mental illnesses, and can also help people with their um, post-operative recovery process. Health technology is the application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, and systems developed to solve a health problem and improve quality of lives. So, what are the importance of UHC in medical tourism? So through UHC, all individuals and communities receive the health services they need without suffering financial hardship. It includes the full spectrum of essential, quality health services, from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. UHC protects people from the financial consequences of paying for health services out of their own pockets, reduces the risk that people will be pushed into poverty because unexpected illness requires them to use up their life savings, sell assets, or borrow, destroying their future and often those of their children. So UHC strategies enable everyone to access the services that address the most significant causes of disease and death, and ensures that the quality of those services is good enough to improve the health of the people who receive them. So the purpose of the UHC in medical tourism is to promote health, to heal, and to provide and to increase the quality of life of the individuals that are being served. So healthcare holds a significant place in the quality of human capital, and the increased expenditure in healthcare increases the productivity of human capital, thus making a positive contribution to economic growth. Last but not the least, why should health promotion be mainstream? So we always say that an ounce of prevention is better than a pound of cure. In practical terms, the cost of instituting health promotion and prevention is less than the cost of paying for treatment and hospitalization. So there are several health interventions that can be done at the level of families and communities, even before the patient contacts the health system. So health promotion will empower and capacitate Filipinos on how to take charge of their own health. So, health promotion improves the health status of individuals, families, communities, states, and the nations. So, health promotion enhances the quality of life for all people and reduces premature deaths. So, health promotion should be mainstream because there is a bigger successful if it uses a multi-level approach, and it can influence individuals and groups by having a different strategies at different levels.
PhilHealth membership, benefits, and financing. So what is PhilHealth? It was established in 1995, and it aims to financially help Filipinos with their medical expenses. Contributions made by members and funding from both local and national governments enable PhilHealth to operate and aid its contributing members. So the government requires all employees to become PhilHealth members, even if you're just a self-employed individuals or what they called also called as voluntary members can also apply. PhilHealth works like an insurance company, except that it is mandated by the government. The agency can help cover your medical bills or parts of it. However, there are eligibility requirements you must meet before you can enjoy PhilHealth benefits. PhilHealth membership is currently achieved through a variety of subsidized and contributory schemes. It was reportedly covers 22% of the population, but a significant proportion its members are unaware of or are unable to access their benefits. PhilHealth benefits packages are specific to type of membership, and provider payment systems are equally complex, with different approaches applied to different benefit packages. Under the UHC law, all citizens are automatically entitled to PhilHealth benefits, including comprehensive outpatient services. PhilHealth will be responsible for purchasing all individual-based services, including supplies, medicines, and commodities, as well as maintenance and operating expenses of health facilities. PhilHealth's provider payment systems will be reformed towards local budgets of contracted HCPs, and the DOH will maintain responsibility for population-based services as well as salaries for government healthcare workers. The agency typically pays parts pays parts of the doctor's professional fees, laboratory tests, and other medical costs. So we have here the available PhilHealth benefits. First is the inpatient benefits. So if you are admitted to a hospital to receive care, you can get PhilHealth benefits. Part of your total bill will be shouldered by the agency as long as the hospital where you were admitted is a PhilHealth partner. Next is outpatient benefits. If you need medical care but do not need to be admitted, you can still benefit from PhilHealth. The agency can cover part of the entire cost of your day surgery, hemodialysis, radiotherapy, and other primary care. Doctor's consultation is also covered as PhilHealth benefits for outpatients. We also have here the Z benefits, like treatment for leukemia, prostate cancer, breast cancer, and cervical cancer is also covered by PhilHealth. However, the agency doesn't cover the entire amount of the treatment, and you have to go to a PhilHealth partner hospital to get Z benefits. Last, the SDG related benefits, like animal bite, HIV/AIDS, outpatient anti-tuberculosis treatment are covered by PhilHealth's SDG-related benefits. Just like its other class of benefits, PhilHealth should part of your treatment costs. Knowing the benefits you can get by being a PhilHealth member can help minimize your medical expenses. Your qualified dependents can also enjoy the same PhilHealth benefits you have. If you are a foreign or dual citizen, you can still get these benefits. Just make sure to be on top of your contribution to avoid any inconvenience when claiming your benefits. The law strengthens PhilHealth by transforming it to become a national purchaser of individual-based health goods and services. To support this larger purchasing role, premium contributions to PhilHealth will be complemented by increasing government contributions from receiving taxes, annual appropriations, and revenues from the Philippine Amusement and Gaming Corporation and the Philippine Charity Sweepstakes Office. Service delivery structure. The delivery of public PHC services is currently controlled at the barangay and municipality level. Patients struggle to access the continuum of care across administrative boundaries. The DOH faces challenges in signaling strategic priorities to primary care providers and in enforcing quality standards. To address the fragmentation of service delivery and move towards providing comprehensive and integrated care, providers are encouraged to form province and citywide HCPS. And these networks can be composed of both public and private or a mixed set of providers that will deliver primary, secondary, and tertiary services. HCPNs will prioritize strong primary care. Primary care providers will deliver continuous comprehensive and coordinated first contact care as well as manage navigation of a facilitated referral system.
For the access to medical products, the Philippine market for medical products lacks an effective government coordination and control, and its inefficiency has led to uniquely high drug prices. So the UHC law mandates the establishment of a Health Technology Assessment or the HTA Council to guide pharmaceutical procurement, which will ensure that the most cost-effective and affordable medicines, supplies, and commodities will be purchased by the government. Regulation under Universal Health Care Law. Question: will there be reductions in the types of benefits that are currently being given by PhilHealth? The answer is there will be no reductions in the currently implemented benefit packages under PhilHealth. However, under the UHC Act, the benefit development process will now undergo health technology assessment to ensure that interventions funded by PhilHealth are cost-effective. Next, what is the purpose of accreditation under the UHC Act? The answer is accreditation will follow a rating system to acknowledge better service quality, efficiency, and equity. PhilHealth shall recognize third-party accreditation mechanisms and may use this as basis for granting incentives. This is under Section 27A. This is different from contracting, which is a function of service delivery. Another question: does the UHC Act set maximum retail prices for drugs sold to the public? The answer is, under the UHC Act, DOH is mandated to prescribe markups on drugs and medical devices sold in DOH-owned healthcare facilities. However, PHIC may also use the markups prescribed by the DOH other health facilities it contracts, whether public or private. Are pharmacies or drug outlets required to have generic medicines available at all times? The answer is yes. All drugs are required to carry and offer to the public generic drug equivalent of all drugs in accordance to the existing laws. The Generics Act of 1988 and the Cheaper Medicines Act of 2008. Under the UHC Act, this was further strengthened, mandating that drug outlets to carry generics, particularly fair-priced, unbranded generics for all drugs, addressing the common diseases and the community as contained in the primary care formulary. So, for the health workforce, there is a chronic deficiency of healthcare professionals, especially in geographically isolated and disadvantaged areas. Some of the main reasons for this include difficulty in attracting personnel, lack of resources to finance the positions, or weak prioritization by local government units or what we call LGUs. Additionally, undergraduate training programs for health professionals in the country do not feature specific training for the provision of primary care. So to address healthcare worker deficiency in the short term, the DOH will expand its deployment programs to augment workforce needs. So all government-sponsored scholars will be mandated to serve in DOH identified areas for at least 3 years. And in the long-term run, the law envisions that LGUs will be capable to independently finance and manage their own health workforce. And the law also focuses on strengthening the provision of primary care through appropriate training of human resources. And it mandates realignment of undergraduate and graduate curricula for health professionals to focus on forming essential primary care competencies. While this long-term change is being pursued, a primary care certification will be required for health professionals to practice as primary care providers. Human Resources for Health. Question: how will the UHC Act comprehensively address issues of human resources for health? So the answer is, the following mechanisms will ensure that there will be enough human resources and the different levels of the health sector. A. National Health Resource Master Plan. B. National Health Workforce Support System. C. Scholarship and Training Program. And D. Return Service Agreement. Another question: will doctors, nurses, midwives, and others under the DOH deployment program be hired under Plantelia position? The answer is, under the UHC Act, all health professionals and healthcare workers will be guaranteed permanent employment and competitive salaries under Chapter 6, Section 23. Mechanisms and processes of this provision are being discussed with the Department of Budget and Management insofar as public sector health workers are concerned. For the health information systems, these have been challenged by lack of structural and technical capacities, duplication of efforts, and unconsolidated and incomplete data. Lack of interoperable mechanisms to bring together multiple information systems lead to inefficiencies and restrict data consolidation. So, the UHC law mandates the maintenance of interoperable information systems and standardizes the necessary health data for collection from providers, which are required in licensing and contracting agreements. Service delivery and local health systems. Question: as a current patient of a specialist, am I required to go to a primary care provider? The answer is, you may still retain your specialist doctor, but after he or she is able to treat you, you must be referred back to a primary care provider. A specialist can be certified as a primary care provider provided that he or she must receive a certification in primary care as determined by the Department of Health. However, during emergencies, you can consult directly with any physician like generalist or specialist most accessible in your area. Another question: are government physicians automatically considered as primary care providers? The answer is, government physicians can be certified primary care providers. The DOH will prepare a mechanism to recognize and certify the abilities of government physicians to deliver primary care. Question: how will individual providers, examples, professionals, be engaged in the healthcare provider networks? The answer is, individual providers must agree to come together and formalize a network arrangement by way of a legal instrument, such as incorporation or partnership. PhilHealth will then contract these patient-centered healthcare provider networks with legal identity. Clinics, diagnostic labs, and drug outlets, along with hospitals, need to work together, whether public or private, to deliver effective and efficient care. Various mechanisms for partnership may then be explored.
For the Table 2, the major provisions of the UHC law. In leadership and governance, in national government, before UHC law, gaps or lacking in licensing and regulations of health facilities by DOH, particularly primary care facilities. When the UHC law mandates mandatory licensing and regulatory systems by DOH for all health facilities, including primary care facilities. In the local government, provincial and municipal offices, before UHC law, fragmented administrative, technical, financial, and operational management of local health systems, primary to tertiary care down to individual municipalities. When the UHC law mandates province and city-wide integration of administrative, technical, financial, and operational management of the local health systems, which means when the UHC law mandates, they are united as one, which is the province and the city. In financing, coverage, before UHC law, multiple memberships schemes that make member management inefficient. They are not effective in member management. So when the UHC law mandates guaranteed PhilHealth membership for all citizens, simplified two-tiered membership scheme, direct contributory or indirect subsidized, which means guaranteed of being a member. In purchaser, before UHC law, PhilHealth purchases services from providers through piecemeal benefit packages and reimbursement. They just give small benefits. When the UHC law mandates prospective performance-based global budget payments for HCPNs, which means the healthcare provider network. In find source, overlap in populations and individual-based services funded by DOH and PhilHealth, that is before UHC law. When the UHC law mandates population-based services financed by DOH and LGUs, individual-based services financed by PhilHealth. In the salaries, public sector salaries paid by national and or local government. When the UHC law mandates no change, there is still no change. Intervening laws, civil service regulations, and political landscape restrict opportunities to move to performance-based payment of salaries. In the service delivery structures, point of contact, before UHC law, first contact care sought at any level of care. When the UHC law mandates the continuing comprehensive and coordinated referral system managed by a primary care provider. And next is provider. When before UHC law, fragmented delivery of services at various levels of care. When the UHC law mandates CPNs or the healthcare provider networks organized within province or city-wide health system. In access to medical products in prioritization, no institutionalized, objective, and transparent prioritization process. When the UHC law mandates HTA, institutionalized through an HTA Council for all medical goods. In procurement, before UHC law, inefficient per facility procurement prone to bidding failures and ultimately stockouts. When the UHC law mandates centralized or pooled procurement mechanism for drugs and medical devices to leverage economies of scale and improve negotiation leverage. In the health workforce, training, before UHC law mandate general undergraduate training as default primary care training, but with recognized inadequacies. When the UHC law mandates undergraduate and graduate training and curricula design and realigned to focus on primary care competences. In primary care certification before UHC law, no required certification to practice primary care. When the UHC law mandates certification based on primary care competencies required for primary care providers. In the health information system, the platform, multiple existing health information systems with limited interoperability. That is before UHC law. When the UHC law mandates in platform, interoperable health information systems required for all health services providers and insurers and should be accessible to the public. In data unconsolidated and incomplete data that translate to poor quality and limited opportunities for analysis and utilization. That is before UHC law. When the UHC law mandates in data, standardized data submitted by all health facilities as a requirement in licensing and contracting. So let's proceed to the conclusion. The Philippine UHC law addresses the inequities faced by the country's health system because of fragmented service delivery and inefficient financing systems. The government and its stakeholders continue to work towards a responsive health system that delivers quality care without the risk of financial burden to its citizens. So the Philippine UHC law wants to make it fair for all of the Filipinos or all of the citizens here in the Philippines when it comes to the health systems and especially in inefficient financing systems. The UHC law addresses health system challenges through, first, guaranteeing access to appropriate health services for all Filipinos through functional HCPNs or healthcare provider networks. So the UHC wants to help or wants to ensure every Filipino is healthy because health is very important. Second, ensuring strategic and adequate financing and purchasing services. So they make sure that every Filipinos are being provided when it comes to financial and in quality health services. Third, engaging local governments to effectively manage local health systems. So the local government make sure to manage all the local citizens when it comes to the health. So lastly, building capacity in terms of qualified human resources and seamless information systems. So they sought to have a competent or a licensed professional to handle the patient to ensure.
We have the 5 Philippine healthcare law that we chose. So first, we have the Act that amending Republic Act 4226, otherwise known as the Hospital Licensure Act. So this act has been in force for over 20 years, but still there are a lot of hospitals and health services establishment that operates in the country who violate this law. Some even manage to operate without license. So the fine that imposed on person or association that operates without license has been increased from 500 to the first offense to 5,000, and from 1,000 to the second offense to 100,000.
So the next Philippine healthcare law is the Republic Act 349 legalizes the use of human organs for surgical, medical, and scientific purposes. So organ transplants are a necessity. When organ transplant is the only difference between life and death or life ladder with physical and other complications, legalizing the use of human organs may result as a advantage, but somehow there's also a disadvantage. So we will talk about first the advantage of legalizing use of human organs. So the first one is the lifesaver facilitator of better life. Organ transplant is a lifesaver, in other words, a life giver. So today, a person with an ailing liver, failing kidneys or heart can hope to live with an organ transplant. So a blind person can see. An ailing person may become healthy. Organ transplants don't just benefit the recipient but also changes the lives of their loved ones. Second is unmatched act of kindness. So organ transplants allow people with perfectly good organs to donate them so someone can live or have a better life. Many people pledge to donate their organs when they die. So this is not only an act of kindness, but it is almost godly. So there can be no greater joy or even accomplishment, yes, than to save someone's life or to improve someone's life, even if that person is a complete stranger. So, however, there is also a disadvantage of it. So, the first one is the possible risks. So, organ transplants require surgery. This surgery are always invasive. Yes, because there are a substantial risk of organ transplants, and it is possible a surgery can go wrong, and a particular body can reject an organ. So there can be side effects after procedure is done, and a new organ doesn't always assure a better life. So the second one is the uncertain wait. So the waiting for an organ can be painful. So a recipient may wait forever, and then the organ may not available in time. So the wait is also painful for the family, of course, a deceased donor. Yeah. However, the truly decent road will be to allow people to withhold or give their organs freely, especially upon death, even if in exchange for money. So yeah, thousands of lives will be saved. Once again, humanitarianism is best served by the respect for civil liberty. Thank you.
Republic Act of 7170, or also known as Organ Donation Act of 1991. It is an act authorizing the legacy or donation of all or part of a human body after death for specified purposes. The Department of Health is encouraging families to consider organ donation of deceased relatives, including those who have been declared legally and medically brain dead, to help others in need of transplantation. With the passage of Public Act number 7170, organ and tissue donations from donors who have been declared brain dead has been allowed. The human transplantable organs include the kidneys, liver, lungs, heart, intestines, and pancreas, in addition to human tissues such as eye tissues, bones, skin, and blood vessels. Through organ donation, one deceased human being can potentially save and dramatically improve the quality of life of 8 or more individuals. The DOH also discourages incentivized organ donations where living organ donors not related to the recipient are motivated by financial rewards. This system creates a risk for both the donor and the recipient, exposing them to further injury. The World Health Organization Data from 2017 show that deaths caused by various end-stage organ diseases involve up to something 230,000 Filipinos, and this may have been prevented by organ transplantation. But unfortunately, organ donation from brain-dead patients remains dismally low in the Philippines. To heighten Filipino consciousness on the benefits of organ sharing, a presidential proclamation is being proposed to be issued designating the month of September of every year as National Organ and Tissue Donation Awareness Month, with the campaign slogan, Dugtong Buhay, Ako Kabahagi Mo. The program underscores the Filipino spirit of bayanihan word of extending help, do not expect anything in return. The DOH, through the Philippine Organ Donation and Transplantation Program and the Philippine Network for Organ Sharing, continues to sustain advocacy and educational campaigns on deceased organ donation.
One of the important healthcare or medical laws in the Philippines is the Presidential Decree 541. This is all about allowing former Filipino professionals to practice their respective professions in the Philippines so they can provide the latent and expertise urgently needed by the homeland. And this is composed of three sections. This presidential decree of 541 was made by Ferdinand E. Marcos during his presidency in the Philippines. And this is done in the city of Manila this 20th day of August in the year of our Lord 1974.
So I choose the Law Presidential Decree 1519. It gives Medicare benefits to all government employees regardless of status of appointment. So the main provision in this bill is every Filipino or the local community or citizen employee will be automatic inclusion into the National Health Insurance Program. So here are the list of exclusion. The benefit granted under the medical care plan shall not cover any expenses or not qualify to this law. First, cosmetic surgery or treatment. Second, optometric services, which means surgery about the eye. See psychiatric illness or have a mental illness such as depression, anxiety, etc. And the normal obstetrical delivery, a pregnant woman who has labor in a long 16 to 18 hours or that has a abnormality in labor. E. Services which are purely diagnostic.